Canner, just to double check, are we good to go anytime?
Yes, we are good to go.
Good morning. Welcome to the 7th meeting of the Legislative Committee on Healthcare for the 2019-2020 interim. Thanks to everyone who's joining us online today. We appreciate your participation. Members, please remember to mute your microphone when you're not speaking. Our committee policy analyst is going to call the roll today. Ms. Kamlasi, please go ahead.
Senator Hardy.
Here.
Senator Ratty. Senator Woodhouse.
Here.
Assemblywoman Monk.
Here.
Assemblywoman Titus.
Here.
Chair Cohen.
Thank you, and I am present. We have a quorum. Sorry, a little technical difficulty. Some housekeeping items. Meeting materials can be found on the committee's webpage. Anyone who would like to receive electronic notifications of and access to the committee's agenda, minutes, or final reports can sign in at the Nevada. Am I still muted? I'm sorry. Can sign in at the Nevada Legislature's website. We'll have 2 periods of public comment, one at the beginning of the meeting and one at the end of the meeting. Public comment is limited to 2 minutes per speaker. The initial period of public comment will be limited to 45 minutes. Any additional public comment could be provided at the end of the meeting. There are 4 ways to provide public comment, all of which are listed on the agenda. These include calling into area code 669-900-6833. And I'll repeat that. That's 669-900-6833. And then entering meeting ID 910-9738-4301 hashtag. Once again, that's ID number 910-9738-4301 hashtag, or emailing comments to healthcare, all one word, healthcare@lcb.state, spelled out STATE.nv.us. So that's healthcare@lcbstate.nv.us. Mailing comments to the Research Division at 401 South Carson Street, Carson City, Nevada, 89701. That's mailing comments to the Research Division at 401 South Carson Street, Carson City, Nevada, 89701. Or faxing comments to phone number, to fax number 775 684-6600, 775-684-6600. This meeting will be recorded and is available on the legislature's website. Before we begin, I'd like to note that the results of two studies that the committee was required to conduct will be posted on the committee's webpage under the meeting material tab for today's meeting. Senate Bill 636 required the committee to study stem cell research centers, and Assembly Bill 131 continues the study from the last interim of training for unlicensed personnel who provide care to people in certain residential group and healthcare facilities. Due to the abbreviated nature of the virtual meetings, the studies will only be provided to the committee in written form, and any questions may be directed to me or committee staff. AB 131 will be forthcoming, so it's not up just yet, but it will be there in time for the committee to make necessary decisions. So with that, move on to public comment. And let me just get my phone ready so I can do the timing. A second. Okay, and again, each speaker will be provided 2 minutes to ensure everyone is given a fair opportunity to speak. We also encourage members of the public to submit written testimony through one of the methods listed on the agenda. All callers should state and spell their name clearly for the record. LCB's broadcast and production services staff are coordinating the public comment telephone line. BPS staff, please add the first caller to the meeting.
Caller with the last 3 digits, 389. Please slowly state and spell your name for the record. You have 2 minutes. And 1 moment. You may begin. Madam Chair, could I take a few seconds here to get this rolling, and give me 2 seconds here. 1 moment, please.
Okay.
Caller with the last 3 digits, 389. Please press *6 to unmute, and you may begin. You have 2 minutes. Caller with the last 3 digits, 389. Please hit *6 to unmute yourself, and you may begin. We will go with the next call. Oh, there you go. Please begin.
Are you able to hear me on this end?
Yes, please begin. You have 2 minutes.
Well, I learned about some of the agenda items last evening, and I understand that you're going to have a presentation. Oh,
Sir?
Paul. Yeah.
Sir? Can
Yeah.
you please state your name before you start? Thank you.
Yeah,
Please
Ron
state your name.
Walter. It's last name is Walter, W-A-L-T-E-R. I'm the executive director for Remsa Care Flight out of Reno, and I'm also representing the Nevada Ambulance Association today. Learned about the agenda earlier, actually late last night, and I understand there's an item on there from the National Conference of State Legislatures concerning the cost of aeromedical services. Not sure exactly what they're going to be discussing, but I wanted to extend an opportunity, see if you would extend an opportunity to the Nevada Association for equal time to identify some of the dynamics facing the aeromedical services in Nevada and across the country. But I'm going to give you some highlights. Aeromedical services. First of all, CareFlight is a nonprofit organization that's been around for 39 years. Aeromedical services in the state provide a public safety net service, and we're obligated to respond regardless of the patient's ability to pay. For many rural communities, paramedical services are their only connection to higher level of care in emergency situations. Aeromedical services also play a huge part in public safety, providing search and assistance to injured and lost citizens who come to Nevada to enjoy our great outdoor adventures. One of the challenges that aeromedical services as well as ambulance services across the state face is about 60% of our transports do not pay the cost of operations. Those mainly consist of Medicaid, Medicare, and pay, leaving about 30% private insurance. This cost shift is just a reality of our nation's healthcare system today. And unfortunately, what we've been seeing is health insurers unwilling to participate in this cost and decreasing reimbursements over the last several years. With this atmosphere, the survival of both air and ground EMS services is a very much concern. Our margins are tight, and things are becoming sustainable. Yes.
Sir, we're just at over 2 minutes. So what I'll invite you to do is please provide us the information that you'd like to have. Please feel free to send it to the committee, and we'll make sure that all the members get copies of anything you'd like to provide us.
Well, I thank each of you and on the committee for my time. Thank you.
Thank you.
Caller with the last 3 digits, 919. Please slowly state and spell your name for the record. You have 2 minutes. Please press *6 to unmute yourself, and you may begin.
Good morning. My name is Eli Schwartz. I am the chair of the Nevada Commission for the persons who are deaf and hard of hearing. I am also a member of the Deaf and Hard of Hearing Alliance. First of all, I would like to thank you for creating a hearing aid program for children under 13 for the deaf and hard of hearing community during the 80th session. That was a great step to ensuring children have access to hearing aids during the critical time in their development. Hearing aids are not covered by many insurances, but when they are, it is offered a high deductible. Additionally, there is a lot more to cost just a hearing aid, including EMO and battery. To date, no hearing aid has been given out due to the complexity of the eligibility requirement. This is due to the complex nature of obtaining hearing aids and multiple restrictions in the NRS 427A.610. I am here today to ask the committee to refine the language set forth in that language, particularly related to insurance requirement, and to be inclusive EMO and battery as part of the program. I will be working with Senator Spielman to present the BDR. Thank you very much for your time.
Thank you very much.
Caller with the last 3 digits, 610. Please slowly state and spell your name for the record. You have 2 minutes. Please press *6 to unmute yourself. You may begin.
Good morning, and thank you for allowing us time. My name is Christian Giller, G as in George, I-L-L-E-R. I'm the Director of Public Safety Programs for Global Medical Response, as well as the President-elect for the Nevada Ambulance Association. As Mr. Walter indicated, we were here for agenda item 5 as listed for possible action. We're unclear what the presentation will be, so I would just like to respectfully request that we also get fair time before any action is taken. Thank you for your time.
Thank you. And again, please feel free to provide us with any documentation that you'd like to regarding the issue. Next caller, please.
Thank you, Madam Chair. The public line is open and working. There are no more callers at this time.
Thank you. With that, we will move on to agenda item 3, which is approval of the minutes for the meeting on June 17th. Members, are there any questions regarding the minutes? Okay. I want to give us a little extra time because we're having some communication problems, but seeing no questions, I will entertain a motion to approve the minutes of the committee meeting on June 17th, 2020.
Move to approve.
Second.
Okay, I believe that was a motion from Dr. Titus and a second from Assemblywoman Monk.
Yeah.
Okay, great. We'll take a roll call vote to approve the motion. Ms. Kamlasi?
Senator Hardy?
Aye.
Senator Ratty? Yes. Senator Woodhouse?
Yes.
Assemblywoman Cohen?
Yes.
Assemblywoman Titus?
Yes.
Assemblywoman Monk?
Yes.
Okay, with that, the motion passes. Thank you. With that, we will move on to agenda item 4, which is a consideration of the regulations proposed or adopted by certain licensing boards pursuant to NRS 4.225. Letter A is LCB file R040-20 of the State Board of Pharmacy. And then B is LCB file R041-20, also of the State Board of Pharmacy. Mr. Robbins, if you'd like to go forward with that.
Okay, Eric Robbins, LCB Legal. As the chairwoman said, we have 2 regulations, both from the Board of Pharmacy. Both have been adopted by the board, but have not yet been approved by the Legislative Commission. And I believe someone from the Board of Pharmacy should be available if the committee has further questions on the regulations.
Right, and I believe that is Dave Woos, the Executive Secretary for the State Board of Pharmacy, if anyone does have any questions.
Yes, this is Brett Kant from the State Board of Pharmacy General Counsel. I just unmuted myself to let you know I'm available if there are any questions. I'll mute myself again.
Great, thank you very much. Committee, do we have any questions? Okay, I know I have a question. Let me just find that in my notes. Sorry, I'm working with multiple screens for my notes. We've addressed this with other boards on our committee, some concerns with language talking about moral character, but and some vague statements about reviewing moral character by the board. And so let me see if I can find where that is. It's in NRS 639.210. It's the grounds for suspension or revocation of certificate, license, registration, or permit, or denial of application. And then let me see where that is in which of the files that came from, or which of the regulations that was mentioned in. I guess that's in, so that's, I get mentioned in chapter 639 of NAC. Mentions that the executive secretary may require a person who submits their application for issuance of a license or permit pursuant to chapter 453, 454, or 639 of NRS, or an application for the renewal of any such license, certificate, or permit to appear at the next regular meeting of the board if the application contains any information that indicates the applicant engaged in conduct which would be prohibited pursuant to NRS 453.236, 639.210, or 639.2895. So that just led me to NRS 639.210 and the language about the grounds for suspension or revocation. And as I mentioned, this committee before has questioned other boards about concerns about kind of vague language in and boards having ability to look at people's moral character. You know, this includes if you go to NRS 639.2, there's reference to if a person is of good moral character is guilty of habitual intemperance, talks about intoxication, which that obviously that is definitely concerned, but then is guilty of unprofessional conduct or conduct contrary to public interest, substance use disorder, and then convictions of violations of the federal government related to controlled substance, etc. So, and then goes on to talk about crimes involving moral turpitude, dishonesty, or corruption. So I guess, can you just address that section of the statute and what the board does, how those determinations are made? Clearly, we want our pharmacists to you know not break federal law when it comes to controlled substances. That's a very clear, bright line. But what's going on with the board when it comes to making a decision about moral character or moral turpitude, that type of thing?
Okay, thank you for your question. Once again, Brett Kent, General Counsel to the board, for the record. And I just, by way of brief background, the proposed regulation would codify an existing practice. I have tried to identify instances in which the board has an existing practice in the way it regulates its licensees that I think should be reflected in a regulation. And so that's simply what this does. But to get back to the heart of your question, understand that the board not only licenses and regulates pharmacists, but licenses and regulates the entire distribution chain for introducing dangerous drugs and controlled substances into our state and ultimately getting them to patients. And so you're talking about giving doctors a controlled substance registration to prescribe and dispense. You're talking about wholesalers that are distributing drugs into our state. And so the issue is if an applicant, whether it's for an individual seeking a registration as a pharmacist or as a doctor wanting to prescribe or dispense, or whether it's an owner of a company that wants to manufacture, wholesale, distribute, or something else in the supply chain, the concern is to make sure that they don't have a criminal background that is, related, relevant to the activity that they're going to be engaged in Nevada in such a way that it could pose a risk to the public and to Nevada patients. And two, that they don't have a substance abuse issue themselves, or at least if they have had it, that it's disclosed and that the board can make a determination that the individual substance abuse issue has been treated and solved, and that the individual might not be a risk for diversion if they have access to controlled substance or dangerous drugs. And so that's when those types of disclosures are made, either on an initial application that the applicant has a background that includes some sort of criminal history that's relevant to the issue of pharmaceutical care, or that they have had a substance abuse issue. The board wants to be able to assess that individual or that applicant, or on initial application or on renewal, if that happens once they've been licensed, to determine whether the individual can once again engage in that licensed activity in a way that doesn't pose a risk to Nevada patients.
Okay, thank you for that. Committee, do we have any other questions?
Yeah. Go Hardy.
I believe that was Dr. Hardy. Please go ahead.
Thank you. I mean, recognizing the reality of substance abuse, what is the plan for those who have already partaken of the forbidden fruit, I'll call it, and how do we keep them in the system, and how do we then allow others to do this? And like the chair said, I have another concern because, I'm a Republican and I have voted against a tax and have been called immoral because that's not immoral. So that's a fraction of moral turpitude by some people. So the concept of morality is a flexible thing. Can you address that?
Well, once again, the board makes these determinations on the record at a public meeting, and it's had a long precedent that it is focused on criminal conduct, or if there's been past substance abuse, to the extent it's directly related to the activity for which they want a license, and nothing further than that. And like I said, I think there's a direct nexus if an individual has a criminal history that's related to whether it's trafficking, whether it's diversion, something related to controlled substances and dangerous drugs. And same thing if they've got that substance abuse history. Now, if they have a substance abuse history or they develop a substance abuse issue while a licensee, the board doesn't, well, one, they have a due process right in their license, but the board seeks to provide them assistance and to, get them resources to address their substance abuse issue to an extent that the board then deems them able to go back to practicing in a safe manner in a way that doesn't pose any risk to Nevada patients. And so the board's goal is one of compliance rather than to be punitive to a licensee or an applicant.
And then on the moral turpitude, do you even want to go there?
Well, I think that's a term that probably is a dated term. I think it was a term that was commonly used in legislation in the past. I think, once again, the board focuses on conduct that is directly relevant to the activity for which the individual or the company is seeking a license, and whether that conduct could, if repeated, or could pose a risk to Nevada patients.
Thank you. Thank you, Madam Chair.
Thank you. Do we have any other questions? Okay, and Mr. Kent, you mentioned that I believe you said that the regulations go up and down the supply chain. So with that, when you also talked about if people need treatment in order to continue working, that type of thing, are for instance, techs given, pharmacy techs given the same type of ability to seek treatment as a pharmacist is given in order to stay in this field and to continue their employment, as opposed to being told, nope, you just have to go find a new career path?
Thank you for your question. Obviously, every circumstance is unique, and the board considers the totality of the circumstances. However, whether you're talking about a pharmacist, a pharmaceutical technician, a doctor, a nurse, or some other professional that develops a substance abuse problem, the immediate issue is, can they currently practice safely, and whether their ability to currently practice and have access to controlled substance and dangerous drugs needs to be suspended for some period of time to allow them to then seek treatment and address the underlying issue. And then when they demonstrate that they've addressed the underlying issue, they come back before the board, and the board restores their license. And that happens regularly. And it doesn't matter, once again, whether it's a pharmacist, a pharm tech, or a doctor. We've had all three instances where the individual wants to seek treatment and address their issue and continue their career. And once they address the issue through treatment and demonstrate to the board's satisfaction that they no longer pose a risk to Nevada patients and having access to controlled substances and dangerous drugs, the board regularly restores an individual's licenses in that instance.
Okay, thank you very much. We definitely appreciate your time. And do we have any other questions? Okay, thank you for that. With that, we're going to move on to agenda item number 5, which is a presentation regarding air ambulance costs. And I'll ask Colleen Becker, who's the Senior Policy Specialist for Health Programs from the National Conference of State Legislatures, to provide her presentation for us on air ambulance costs and regulations.
Hi, thank you, Chair Cohen, for inviting me, and thank you and good morning to the members of the committee. Let me get my slideshow going. Sorry, give me 1 second here. Okay, does everyone see my presentation?
Yes.
Great, thank you. So again, thank you for letting me present today on state action related to the issue of surprise billing and air ambulances. My name is Colleen Becker, and as the chair said, I'm a senior policy specialist with the National Conference of State Legislatures. And quickly, before I dive into the presentation, I want to take a minute to remind you about NCL and that we're a nonpartisan instrumentality of the states. And our mission is to support state legislatures and to help them be more effective and efficient. Our members include the 7,383 legislators and the 20 to 30 or so thousand legislative staff for whom we provide research assistance on not only introduced legislation, but also on existing laws and policies. Most importantly, we do not take actions, nor do we craft model legislation. So some background, air ambulances provide ambulance services in areas where patients require emergent care, but a ground ambulance is either unable to reach them, or more often the proper facilities are too far away, or just too far away. They can either be a helicopter or small plane. The Association of Air Medical Services, or AAMS, estimates that a combined total of 550,000 patients are flown by these aircraft per year in the US. Situations where these aircraft are commonly used are traumatic injuries, pregnancy complications, heart attacks, strokes, organ procurement, and other urgent medical conditions. Something to keep in mind is that the services air ambulances provide are usually given in dire circumstances, sometimes life or limb threatening, and many times patients needing air ambulances are unable to give consent. As far as the number of air ambulance service providers, according to the National Association of Insurance Commissioners, or the NAIC, in 2002, there were around 400 air ambulances nationally, but by 2008, that number had doubled to over 800. A study last year by the Government Accountability Office, or GAO, on air ambulance providers supports this by noting that the number of bases for providers for both types have been on the rise since 2012. And here I've included the maps from the GAO study of both types of providers, and we can see that Nevada also saw the addition of at least a few helicopter bases and at least one new airplane base. And this is the fixed wing bases. Most states have multiple air ambulance providers, with some states allowing only certain providers to operate in specific regions. I should also clarify that we're mostly talking about independent service providers during this presentation, but there are also hospital-based and government-run service providers. So air ambulance providers have an unquestionably important role in the healthcare system. All hope they are available should we or a loved one need them. But even if a person has health insurance, it may still be quite costly based on many factors. Researchers involved in the GAO study investigated private insurance data and found that in 2017, the median price for a helicopter transport was over $36,000. And the median price of an airplane transport was just shy of $41,000. Furthermore, they estimate that 69% of those rides were out of network. And that means that the air ambulance provider did not contract with the patient's insurance carrier. Researchers Lauren Adler, Aaron Fuse-Brown, and others who also studied commercial claims data from the same time frame projected that number to be even higher at 77%. Whether it is a hospital, physician, or an air ambulance, if a patient's insurance carrier doesn't contract with the facility or provider, the patient can unknowingly be held responsible for paying part, if not all, of the provider's charges. And this is referred to as surprise balance billing. Reflecting on the data I just presented, that can obviously run into the tens of thousands of dollars for air ambulance services. As far as Medicaid and Medicare beneficiaries, the Center for Medicare and Medicaid Services has an established fee schedule for air ambulance providers, and thus those providers have to accept whatever Medicare or Medicaid reimburses them, which is typically lower than what is paid by other payers. Also, CMS has a rule prohibiting providers from balance billing patients. AAMS estimates that up to 70% of air ambulance transports are Medicare or Medicaid members. However, the GAO study estimates that number to be a little less, around 56%. So currently, there are 30 states that have at least some protections for their consumers from surprise balance bills, including Nevada. But those protections only extend to insurance plans a state can regulate, and moreover, states are precluded from regulating air ambulances due to the Airline Deregulation Act of 1978. In the interest of time, I'm not going to go into this slide, but it details, has a lot of detailed information. from the Georgetown Center on Health Insurance Reform. And I inserted it because it describes the specific balance billing protections in Nevada. However, again, nothing in Nevada state law addresses surprise billing from air ambulance providers. So who does regulate the air ambulance industry? That is under the authority of the Federal Aviation Administration and the Department of Transportation. And what that means is that since states are prohibited from regulating air ambulances, they are prohibited from protecting consumers from balance billing from air ambulances. There's a long precedent of federal rulings and law preventing states from regulating numerous aspects of the industry, but as I just said, the most notable is the Airline Deregulation Act of 1978, or the ADA, which specifically preempts states from regulating the rates, route, and service of air carriers, which air ambulances are certified as. The ADA includes issues such as certificates of need or public necessity, pilot training, limitations on geographic service areas, and mandating services included in a provider's subscription or membership. Oops, sorry, jumped ahead there. So you're probably thinking, well, what can a state do? And what have lawmakers tried before? Even with the ADA in place, legislators have made several attempts to pass laws to prevent air ambulances from balance billing patients. And although many of them have failed, a few of them have had some limited success. Where most state proposals have synergy is that patients should not be in the middle of balance billing disputes, period. So for instance, a Montana law passed in 2017 holds patients harmless in situations where they are transported by an out-of-network air ambulance provider. The insurer must negotiate payment directly with the provider, and they're prohibited from balance billing the patient. And importantly, though, this law only applies to hospital-owned air ambulances and not independently owned or government-owned. North Dakota also passed legislation in 2017, which did three things. The first thing it did is required hospitals that refer patients for non-emergency transport to another facility to first notify the patient or their representative of the contractual relationship, if any, between the patient's health insurer and the air ambulance provider. The next thing it did was it prohibits air ambulance providers from selling subscriptions. So according to the North Dakota Department of Insurance, they found that these subscription plans often duplicate coverage, rendering it basically unnecessary. And the third thing it does is that it bans air ambulance providers from balance billing patients in instances where an air ambulance is out of network. The insurer is required to pay the out-of-network provider the average of in-network rates they pay for other providers of the same type, which they contract with. So this law is being challenged in court, and it's expected to be heard in early 2021, citing the ADA rule. So speaking of court challenges in Texas, the Texas Department of Insurance's Division of Workers' Compensation filed a lawsuit along with several workers' comp insurers against PHI Air Medical Inc., stating that they are not required to pay privately owned air ambulance companies the full amount of billed charges, and that under the Texas Workers' Compensation Act and the Division of Workers' Comp rules, they are only required to pay a reasonable reimbursement, which has typically been a reimbursement of about 125% of Medicare rates. So PHI argued that the ADA preempts state law, but in July, the Texas Supreme Court ruled in favor of the Texas DOI and insurers, and I believe that has been appealed as well. So looking at legislation that went into effect this year, like North Dakota and Montana, California passed a law that prohibits out-of-network air ambulance providers from balance billing for amounts over the patient's in-network cost sharing. So that's regardless of network status. And this went into effect in January, and I have not heard or seen that it is being challenged yet. And then I added this, even though it was denied, it was a kind of an innovative approach. So Wyoming went about using a section Medicaid, a Medicaid section 1115 waiver And it essentially proposed to make air ambulance services into a public utility. All state residents would be covered under the state Medicaid program for the purposes of air ambulance services, regardless of income level. And then providers would have had to bid on contracts for specific areas, geographic areas, and they would have been paid a flat rate. However, it was rejected for two reasons, one of which was that it didn't meet the budget neutrality requirements. And the second one, CMS said that, quote, 1115 waivers are not a mechanism for avoiding the application of federal aviation law or the ADA. So the last slide here, I'll talk a little bit about federal action because it's going to take a change in federal law to both address the ADA preemption and also apply to health coverage of all types. Plus, surprise billing is one area where we've seen bipartisan support in both chambers, both nationally and at the state level. So in 2018, the FAA Reauthorization Act included a provision to establish an advisory committee to review different legislative and regulatory options and to make recommendations on policies that would affect price transparency and prevent consumers from receiving surprise balance bills for air ambulance services. The committee did begin its work in January this year, but that work stalled out due to the onset of the pandemic. And there were also several pieces of legislation addressing surprise bills as a whole that were moving through committees in both chambers, but most of those efforts too have stalled. But the most promising effort that included an air ambulance provision is from the Senate Health and House Energy and Commerce committees, which was a compromise, and it was called the Lower Healthcare Costs Act. I'm sure many of you have heard and know about it. And it specifies that patients are held harmless from surprise air ambulance medical bills and that patients are only required to pay the in-network cost sharing amount. And it also allows for either the provider of the health plan or the air ambulance provider to initiate an independent resolution process. And also on a high note as well, just a couple of weeks ago, a bipartisan bicameral joint statement was released by ranking committee members reinforcing their commitment to finding a solution to the overall issue of surprise billing. And so I like to end on a high note, and that is my presentation. And this is a list of resources with links as well that I think are going to be provided. So thank you again for allowing me to present on this. Let me quit sharing though. There we go.
Thank you for that. That was really informative. Do we have any questions, committee? Dr. Hardy.
Thank you, Madam Chair. I guess it was Texas, I think, that allowed 125% of Medicare rate for an air ambulance. What does Medicare pay for an air ambulance? Do they have a rate? And if so, how does that relate to reality of how much it costs? Because it's hard to make a living with the Medicare rate, even 125% of Medicare rate. So what is the reality of that? Or do we have testimony that's going to address that?
So you're right, there is an established fee for air ambulances through Medicaid, and I apologize, I don't know what that actual percentage is. But traditionally, you're right, most Medicare and Medicaid fees are substantially less than what commercial payers pay. So there's that balance. And as I was stating earlier, anywhere from 56 to 70% of air ambulance transports are Medicare or Medicaid based. So that is definitely something to consider when considering these proposals and how they're going to affect different actors in that chain. But yeah, so I don't know actually what the percentage is, and I'd be happy to look into it or I'm not sure if some other folks were going to participate and send some materials, but I will make sure that I look into that for you.
Well, let me ask it this way. Would 125% Medicare rate even pay for the gas, the nurse, the pilot, et cetera? I mean, recognizing that if it weren't for the payers that are paying out of network, how in the world are you going to pay for over 50% of your flights taking a hit where you don't make any money at all? You don't even break even.
Sure, and I'm not certain what their costs are, and it's not just even gas too. It's personnel and maintenance and having the right equipment on board. So I'm not sure how much their costs are and what that balance is to the $30,000 to $40,000 that they have to charge. But again, to your point, you have to make up those costs somewhere. So I'm not sure what those costs are though.
Not to mention buying a plane and buying a helicopter. Thank you. Thank you, Madam Chair.
Yeah.
You're welcome. And Ms. Becker, kind of following up on Senator Hardy's question. So you mentioned that flights can be independent, hospital-based, government-owned providers. Do we know, is there a difference in where there tends to be more of which kind, in which states, and where the legislation is? I mean, for instance, when you talk about, okay, well, they've passed this in California or they passed that in Texas, does there tend to be more hospital-based in Texas, that type of thing? Or are there trends like that we're seeing?
That is a good question. The only thing that I can speak to is that I know Montana, their legislation applied specifically to hospital-owned providers. I had outreached them to kind of get the Division of Insurance to get a little bit more information about why they went with hospital-owned versus other providers, as well as some of the background on the legislation. And I have not yet been able to connect with them, but I don't know what the balance is per state. I would assume that it would be very different. All I have is the GAO report with the maps as to which provider or how many providers are in which. I know that there is also an atlas as well that is accessible through AAMS, but the data, as I understand it, is a snapshot in time versus concrete numbers. So I think it's an evolving thing. So, but that's about the only information I have. And again, I'd be happy to look into Nevada for you.
Okay, thank you. And then along the same lines, when we talk about hospitals, they can be private hospitals for profit, not necessarily a not-for-profit hospital. Correct?
Correct, yes. Yeah, I mean, they're different. There's not-for-profit, there's profit. So it would depend on I'm not sure how the legislation affects different hospital groups either.
All right, thank you. And then you mentioned the GAO study that said there's been a steady increase in usage since 2012. Is there an indication as to why there's been a steady uptick in usage since 2012?
I believe they do have some information on that. I think part of it is the increase in insured folks having access to services, especially Medicare and Medicaid folks, and the increase in enrollees. But I'll double check that information and make sure I'm not speaking out of turn on that.
Okay, I was also kind of wondering, for instance, if there might be a correlation between closures of rural hospitals and rural clinics, and that might be causing more of a usage. But so I'd be kind of interested to see if that has any correlation to it. But anyway, okay.
I'll see what I can find for you.
Thank you. I'd appreciate it. Do we have any other questions, committee?
Madam Chair?
Dr. Hardy?
Thank you, Madam Chair. Is there a statute, a federal statute that forces a business to do business in a given state? In other words, so if Nevada did something egregious to the industry and the industry said, well, you know, we can't afford to be there, then we've basically taken our rural population and the people who drive on our roads through the rural population, and we've said, sorry, we don't have any way to get you there in time. So is there a statute federally that forces a state or all states to have a air ambulance service?
Yeah, I believe it's state law that we have to have. There's not a national law that I know of, but I believe there's many state and local laws saying that there must be services available, not including your network adequacy standards very often apply to those services as well. Again, I don't know the specifics as far as Nevada and what the requirements are as far as networks there, but I would assume most states have it built into a lot of their network adequacy.
Well, you're talking about an insurance company has a statute that says, yes, you have to provide air ambulance, but as you point out, the out of networks don't have that. So there's nothing nationally that says you have to have an air ambulance accessibility. I mean, they can say, okay, we don't go there, but the insurance companies have to do that. So we have apparently we have a state law that says if you're going to do business with any insurance company in the state of Nevada, you have to provide the same service for somebody who's out of network. Is that what you're saying?
Sorry, you were cut up at the last end of the question there and I had to unmute myself. So you were saying that they still have to provide the service?
So I guess when we do an insurance policy in the state where we require an insurance company to cover a certain population of their specific people, and does that flight requirement, air ambulance requirement, require them to pick up anybody anywhere in the state? Or do they have the option not to pick up anybody if they're not in their network?
Well, it's dependent. We're kind of mixing two things there. So you're right. The insurers have contract with specific folks, but I don't believe air ambulance providers have an option on picking up folks, whether or not they want to. They have an obligation, a state legal obligation to pick folks up, whether or not they get paid or not, I believe.
Is that a state law or is that national?
State law, as far as I knew. I don't think there's national law. I could be wrong. This is not, I'm not as well versed on the national scope of this issue. I would need to ask my colleagues in DC. I apologize. I don't know that information, whether there's a national law. I just know that there are state laws.
So as a state, we don't have the right to say, you're an air ambulance, you have to pick up everybody and anybody, unless we tie that to, if you want to do insurance business in the state of Nevada, then you have to also pick up other people who aren't insured. Is that my understanding? Is that correct?
I believe all ambulance providers have to pick up folks in emergency situations. Now, they may have more of a choice in a non-emergency situation, but in emergency situations, I believe all ambulance providers, ground or air, have to pick up folks. I'm not sure I'm answering your question.
Right, state or national law?
I believe that's state law. Again, I don't I don't know about the national law. I would have to defer to my DC colleagues and double check that. I'm not 100% sure.
I look forward to that. Thank you.
Senator Hardy, this is Megan. We can also look into that as staff. Eric Robbins, the legal counsel, can look into what state law is related to ambulances and the requirement to pick people up, but we can follow up with you after the meeting.
Thank you, Ms. Kamasi. With that, we have a question from Dr. Titus.
So thank you, Madam Chair. And along the same line of question that Dr. Hardy had, I'm curious about the regulations here in Nevada, so would appreciate Megan, if you and Eric could maybe get us what the requirements are here for our state, because I think there's some misunderstanding about obligations and mandatory transports, et cetera. The 911 calls that go out, especially in the rural area, there are lifeline air ambulances are, but it's not the fixed wing. It's actually usually a helicopter, the care flights, that I'd really like to have a follow-up, maybe some document or information from them. I think that our care flight does do balanced Medicare billing, and would like to see that. I also would like to hear about maybe what other states where they've passed regulations. Have any of the air ambulance services been forced to close down? If they say there's a mandatory price that we'll pay, and if that's grossly below what their actual cost is, how can somebody stay in business? So I think we're lacking a lot of information here. Unfortunately, this isn't a decision item. This is just information. But I think now that it's been opened, and I'm sensing the concern about balance billing and people left to cover a charge. I see where this is going, and maybe why this was on here today. But we need a lot of information before we can say, no, you can't come after the individual, et cetera, and or, should we be holding the insurance companies accountable and mandate that they pay these bills? And that's one of my concerns. In rural Nevada, believe me, when we heard from Remza earlier in public comment and regarding care flight and the transports, our local ambulance services will not transport somebody frequently from our hospital to the tertiary centers. It is only care flight that will do that many times. We don't have paramedics out here, and to assume that they're going to do that pro bono always and still stay open is pretty naive. So I think we need a lot more information. It's a topic that we haven't discussed before, but boy, since we've gotten here, I think it would be helpful to see what the rules are here in Nevada, see what the bottom lines are as far as staying afloat. And again, back to our presenter, what states have they lost any providers, air ambulance providers, by having regulations? Do we have any information on that? That would be my question.
So I can actually tell you that I talked with John Godfrey, the insurance commissioner in North Dakota, and they so far have not seen a decrease in providers since their law was implemented in 2018. So they have not seen a decrease in providers. That much I can attest to.
So I think the follow-up one then would be to see where we are in Nevada, see what the obligation is for, because I've frequently had, when I'm doing an emergency room and I need somebody transported out, I've called our local ambulances and they can't come, they're busy or they won't transport, they don't have anybody available. The air conditions aren't such, like a smoky day like today in Nevada, care flight can't fly. I mean, it can be a fairly desperate and pretty dramatic time trying to get somebody transported out. So any limiting on that accessibility would be pretty dramatic to rural Nevada.
Okay, well, I would say, Dr. Titus, I don't think you should, state that you see where something's going. Every legislator has a right to bring any BDR they'd like to bring, and certainly, every bill is vetted during session. So, if a bill comes from a presentation, it will be fully vetted during session, and all parties will have an opportunity to present at a hearing, if there is in fact a hearing, but don't presume because we have a presentation at an interim committee that the writing's on the wall about anything. With that said, as I told the commenters during public comment, they certainly have a right to provide us with any information that they'd like to provide us with. And we definitely appreciate Ms. Becker providing us with the information that she's providing with us today, because this is an important issue for a great deal of Nevada, especially in the rural areas. So we do want to make sure we have that information. But certainly we can get the information that you're interested in. As Ms. Kamwasi stated, she and Mr. Robbins can provide that information to you and to the rest of the committee, and answer Dr. Hardy's questions. And Ms. Becker stated, as she stated, she'll provide us with more information so that we can get a fuller understanding of this situation and what's going on in other states and how legislation is impacting the citizens in those states when they do have legislation that's passed. With that, do we have any other questions? Go ahead, Vice Chair Reddy.
Thank you, Madam Chair. Just wanted to ask, as all of the parties are gathering information to share it with us, whether that be the folks who presented during public comment or our friends at NCSL or our own staff, if as you're looking at the information, if you could sort of break it out into emergency transport that is part of the EMS system, as in there's a crisis, that person needs to be transported now, it's a 911 call, and medical transport that needs to happen, but there's more flexibility around timing, and there's often, more opportunity to have options or to be thinking about different ways to do it. And I understand that the situations in the rurals, there's maybe a scarcity of options, but since we're looking at not just what happens in the rurals, but also what happens in our larger urban areas, I do think that distinction is really important, because I think at least from what I'm familiar with in Washoe County, the mechanisms for doing those two things are quite different. I think in Washoe County, we have a franchise agreement with a single entity that accounts for those types of things. So it's a single entity system, whereas medical transport is very different. So just as you're reading us that information, if you could break it into those two buckets of the true part of the EMS system that is that important critical need, and then medical transport generally, I would appreciate it. Thank you.
Okay, any other questions? All right, and anything else you would like to add, Ms. Becker? Okay, with that, thank you very much.
Thank you so much.
Then we certainly appreciate NCSL always providing us such good information, always such a good partner for us in the Nevada Legislature. We really appreciate it. So thank you. We will move on to agenda item number 6, which is an overview of adoption assistance for children with special needs in Nevada, and an update on Assembly Bill 150 from 2019, which requires the Department of Health and Human Services to study strategies to improve outcomes for children who age out of the child welfare system. With that, I'm going to ask parent advocate Jennifer Robertson to please go ahead and introduce yourself and tell us your story.
Thank you, Madam Chair. Madam Chair, members of the committee, my name is Jennifer Robertson, and I'm a mom of 5 children here in Las Vegas, and I'm with you today to talk about 4 of my kids. When my husband Brian and I were still dating, we had all of those conversations we all have about how many children we wanted and what our hopes for the future were for our family. And he wanted 2 kids. I was an only child and wanted 3. While he came from a stable traditional family of kids with a mom, a dad, 4 kids, I was raised alone by a teen mom and relied more than once on the kindness of family, friends, and even acquaintances to get through a rather unstable childhood. So when Brian and I talked about starting a family, I told him that I'd like to look into foster care. I think he cocked his head and said, "Oh, okay." And that's about how much thought went into that agreement. Years later, when we were unable to start a family naturally, we looked at each other and said, "Want to call about foster classes?" And that was an easy next step. We never looked back, and we were licensed foster parents for almost 10 years. We had kids in and out the entire 10 years. We were lucky enough to adopt our very first placement. He was a wildly angry 2-year-old with fiery curls, and he had a temper to match. And less than a year later, we got a call for a newborn sibling who I brought home from the hospital at 4 days old. We were excited to know that they would grow up together. They would share a similar life experience. They would always have someone who understood exactly what the other one was going through. And 13 years later, I can't tell you, we never could have imagined or anticipated the joy and the challenges that those two have brought us. They've since been joined by another set of half siblings, a newborn girl we were told would stay for a few weeks, and she's starting 5th grade next week, and her little sister who came a year later, who we could not, of course, say no to her placement. We fought to keep our first 2 together as siblings, and we were going to try to keep the younger 2 siblings together. They're unrelated to, each set of half siblings is unrelated to each other, but we thought they all deserved to stay together, and we were going to try to make that happen. And as a side note, the day after that 4th child came home, we found out I was pregnant. So we thought we were done with 3. Suddenly we had 5 in a tiny house, 1 income, and every single day was really, really hard. Our oldest 4 came to us with some known issues, and all 4 were designated special needs adoptions due to some developmental delays and some behaviors that required therapy and later some medication. We later learned that all 4 of them were alcohol and substance exposed in utero. That's either proven or suspected due to years of parental use. You won't find this on their social summaries or on any pre-adoption paperwork, though. This was all documented by us post-adoption while preparing for various evaluations, educational testing, hospitalizations, and some neuropsych exams. I was able to contact birth parents and family members, getting confirmation of prenatal drinking, drug use, diagnosed and undiagnosed mental health issues, and learning disabilities. Compound all of those issues with trauma and a foster care history, in some cases, a multi-generational foster care history, and you can begin to understand the background of my children. Even the newborns I brought home from the hospital myself were dealt a very difficult hand before they were even born. Our children are bright, they're funny, they're beautiful, spirited, loving, they're entertaining, but designating them as special needs adoption was fair and it was accurate. With the designation of special needs came the negotiation of a post-adoption subsidy from the state. We were and remain so grateful for that subsidy. It allows us to take care of our children when, due to their varying needs, I could not work outside the home. With multiple therapy appointments each week, foster care visits, appointments, parental visits, specialists, IEPs, hospitals, trips to school, transportation, caring for 4 kids with special needs has been at times overwhelming, but it would have been impossible without the adoption subsidies. We don't get the full amount. It was negotiated based on need and expenses, but it helps with the basic needs of our kids in a way that we can't thank the state enough for. The post-adoption subsidy here in the state of Nevada stops on a child's 18th birthday. So I'm here today because our oldest turns 18 at the very beginning of his senior year of high school. Now, this is not unusual for many kids. In fact, some of my son's friends have jobs to help pay for their own expenses, college savings, pocket money. But my son, who was a GATE student in elementary, and he homeschooled very successfully for middle school due to his anxiety and other related diagnoses, he's struggling through high school. He has an IEP in place that we fought really hard to get for him, but just getting him through high school is our only goal. For our 4 kids adopted through the state, one moment, I'm sorry. Of our 4 kids adopted through the state, all 4 have IEPs. We have many, many diagnoses, including fetal alcohol spectrum disorder, specific learning disability, dyslexia, ADHD, inattentive, hyperactive, and combined type. We have anxiety, mood disorder, and more. We had a diagnosis of reactive attachment disorder at one point, which we're choosing to believe was an overreaching diagnosis, but it shows the severity of the behaviors we're dealing with. So along with all of those issues my children have, they also have birth parents who struggled with these things and more: schizophrenia, bipolar. Their biological family members suspect that some of the birth parents had undiagnosed and untreated learning disabilities and mental health disorders that contributed to 3 of our kids' birth parents dropping out of high school before graduation. 2 graduated and didn't pursue a higher education, and 1 I'm unsure of. I say all of this to stress our singular goal as parents is to get our kids through high school graduation. Honestly, that's our primary goal. The current DFS policy states, quote, after an adopted child turns 18, regardless of the level of diagnosed mental or physical disability, the adoption subsidy terminates. DFS will refer you to Social Security Administration for SSI assistance, unquote. My son and many adopted kids with trauma backgrounds and learning disabilities likely do not have needs severe enough to qualify for SSI. So our oldest will lose his adoption subsidy on his 18th birthday while living at home as a full-time high school student his entire senior year. Due to his needs and the higher needs of his siblings, I still can't work outside the home. So our son will be required to get a part-time job to help pay for his expenses, including all those senior year expenses that certainly don't come cheap for anyone. Currently, his only job is high school, and that is a struggle. It's the sole thing he focuses on. It's the only real responsibility he has to pass algebra. Last year, he brought an F up to a D, and we celebrated. It was a real accomplishment. He worked very, very hard. And because he's a really bright kid with a drive, he was able to pass a class we weren't sure he would pass. Had he been required to work a job while trying to improve his grades and maintain his mental health, we have no doubt that quitting school would have seemed a viable option to him. He is so smart, and we know this because we've had him tested for everything, but he has to work even harder than most kids. If he had to work a job in addition to worrying about his grades, his social life, his family obligations, and he was 18, I'm sure it would be too late to be having this conversation today. Chairwoman Cohen, members of the committee, I'm here today asking that the post-adoption subsidy for special needs adoptions be continued through high school graduation for kids adopted through the state foster care system. Other states have this in place. I don't know those statistics, only anecdotal evidence from my foster and adoptive friends around the country who maintain their adoption subsidies through the month of high school graduation. Not all states, but many states do have that. But let's talk about statistics. My children are included in so many statistics: foster care statistics, adoption, early childhood intervention, special ed stats, so many statistics. Some of the stats we do not want them included in are high school dropout rates, incarceration stats, public assistance stats, teen pregnancy stats. A quick Google search tells me that 30% of teen girls who drop out of high school say pregnancy is a main reason. The National Campaign to Prevent Teen and Unplanned Pregnancy says that rate is higher for Latino and African American kids. The National Institute of Health tells us 32% of students with ADHD combined will drop out. Approximately 53% of adolescents with FASD have been suspended from school, 29% have been expelled, and 25% have dropped out. We work very hard as parents to prevent our kids from becoming part of any of those statistics. My husband and I are not alone in our concern. We're not the only family. There are hundreds of Nevada families just like ours with kids who would benefit from maintaining an adoption subsidy through high school graduation. For many, including 2 of my kids, this is just a month or so. For others, like my son, it's nearly a year. One mom told me her daughter turned 17 at the beginning of her junior year, and an extended subsidy would really help her family. Her child, like mine, probably doesn't have needs severe enough to qualify for other financial assistance programs after age 18. But make no mistake, as high school students with a foster care background and even mild developmental delays, these are still children. I know it's not an ideal time to be asking for even a few months of additional subsidy from the state, but services are being cut for families like mine, and we need support now more than ever. So thank you for hearing our story. Thank you for listening to this proud mom talk about my very bright, very loved, and very resilient children. Thank you all for your time today.
Assemblywoman Cohen, you're muted.
Thank you very much. Do we have any questions? Okay, I don't see any. Oh, Vice Chair Ratty.
Not a question, just wanted to take an opportunity to say thank you for coming and presenting your story. I was delivered to my parents when I was 5 days old. And I always am so appreciative of any adoptive parent. I feel like I won the parent lottery in my case, and it sounds like your kids do. So thank you for taking the time to be here today and to raise this issue.
Right. Thank you for your comment. I appreciate that.
And just so that the committee's clear, Mrs. Robertson and I we've had the discussion when she first approached me with this possible BDR. It was before the pandemic, when things were going well in our state. And since that time, we've had the discussion about let's say the facts of life for us in Nevada right now. And I didn't want to waste her time being here today, knowing where we are financially, and didn't want to waste the committee's time, but I did think it was important for this information to get out, for us to understand where families in Nevada are. I talked to her about, I don't know, if some money falls from the sky, I'd like the information to be out there. If some amazing federal money comes, I don't know. So just so we all understand, we are all on the same page with this, that we do all understand there probably isn't the money that I think probably most people would want there to be, to kind of fill this gap for these kids and these families that are not just, these families that are not just, frankly, helping these children, but are basically helping our state, right? Because not only are they making their own families whole, but they're also helping our state by taking these children in and supporting these children when otherwise the state would have been doing it. So I do very much appreciate you coming and telling your story and telling us about your wonderful family, and taking the time, especially knowing that where we are financially as the state, but being willing to still put that on the record, and hopefully, if not now, hopefully soon in the future, we will be able to seriously consider this. So unless we have any other questions, or you have anything else you'd like to add, we can move on to Mr. Armstrong from the Division of Child and Family Services. Anything else? Okay, Mr. Armstrong, please go ahead.
Good morning, Madam Chair, members of the committee. Let me also start by thanking Ms. Robertson for the true generosity that it takes to be a foster and adoptive parent, the love and determination that all of our foster parents and adoptive parents have is truly priceless, not for just us as a state, but for the kids and the lives they impact. So certainly from the bottom of my heart, a thank you to you for your work and determination and advocacy today. I have a presentation to walk through kind of what the adoption assistance program looks like, and then also an update on AB 150, which is related to extended foster care bill from last session. And so let me share the presentation real quick. Okay, can everybody see the presentation?
Yes, we can see it.
Great, thank you so much. So as I said, we're going to talk about adoption assistance and Assembly Bill 150. We'll do a quick overview of the adoption assistance program, the eligibility requirements, when that terminates. As we heard, it's upon that 18th birthday. There's some other factors that can help that determine when it terminates, and expenditures, although I'll talk a little bit about that. The expenditures information we have was more relevant in March than now. So I'll talk about that when we get there. And then the reasons that youth receive subsidies, especially the additional subsidies, and some options for Nevada for consideration. And then Assembly Bill 150 will do an overview and the possible implications for adoption assistance. So when we talk about adoption assistance in this presentation, I think it's important to note that we're talking about adoptions where there has been a child welfare case, there's been either a termination of parental rights or a relinquishment of parental rights to facilitate the adoption for permanency. We always go for a permanency plan of adoption. We know that kids, young people who are adopted have much better outcomes rather than those who quote unquote age out of the system. So when we talk about adoption assistance, it's in that context of child welfare cases. And for the last 4 years, the state of Nevada has fluctuated between 750 and 850 finalized adoptions statewide. So the adoption assistance program and really child welfare practice is largely driven by federal law. There's federal funding to assist child welfare programs. And so in order to access that federal funding, we have to meet very specific federal requirements. And so it encourages and supports the federal law, that public law, the Adoption Assistance Act, supports families in adopting children with special needs, and provides a subsidy for special needs. So the eligibility requirement include the child has to be in the custody of the child welfare agency. In Nevada, we have 3 child welfare agencies: the Division of Child and Family Services, which provides child welfare services in rural Nevada, and then Washoe and Clark counties operate their own child welfare agencies. So when we talk about negotiating payments, those are all done with whichever is the local child welfare agency for that child. And the child has to meet the following requirements. The child is getting adopted to be eligible for the subsidy. The child cannot have reached the age of 18, cannot and should not be returned home to their parents. That's a court determination, and then meets one of the criteria for special needs. There are special needs or special factors that are taken into consideration, again, driven by federal law, which includes 5 years of age or older, a sibling group. We heard from Ms. Robertson about trying to keep siblings together. That's such a critical and key goal that we have, to try to keep siblings together even when they're removed from their biological families. Has a diagnosed medical, physical, emotional, or mental disability. Other factors that make them difficult to place, and then is a member of a minority ethnic group. Those are the special factors and needs established in the federal law that make them eligible for the additional assistance. So the assistance comes in monthly payments, and it's as we heard, it's negotiated. It cannot exceed the family foster care maintenance rate. So for foster parents who are taking care of children, the monthly rate for children 0 to 12 is at $682, and for age 13 to 18 is at $773. The negotiated rate for all 3 Nevada child welfare agencies in the last fiscal year really fluctuated right at about $625, $630 a month. And the termination of assistance is set forth in state policy, and it reflects state law. The assistance terminates when the child has attained the age of 18. If the child welfare agency determines that the adoptive parents are no longer legally responsible for the child. If we determine that the adoptive parent is no longer providing actual support for the child, or the adoptive parents indicate they no longer require the subsidy. The available subsidies include necessary medical coverage, social services, financial assistance, and limited reimbursement for adoption-related costs. That translates to attorney's fees for the attorneys who facilitate the adoption, and those rates are established during the legislature each year in terms of those legal fees. I would note that there's additional resources for families, especially with those with developmental disabilities, from Aging and Disability Services Division, including family support services, job and day training, and supported living arrangements. Those are outside of the adoption subsidies discussion. Again, this is of a very small subset of the adoption subsidies, so we're going to get you better information on the cost. This made sense back in March when we were going to originally do the presentation. Now we're in a very different fiscal situation. And so to be helpful to this committee in the current situation we face, we'll put together some of those costs, and we'll see what we can do in terms of getting an estimate together of what it would take to do as Ms. Robertson is advocating for in terms of just getting to the end of high school graduation versus the maximum, which would be to 21. There's some reasons that children, so the different factors, those help explain and let you see which of the special factors triggered the subsidies and options for Nevada. So as I said, child welfare funding is largely federally directed, federally dictated. We get what's Social Security 4E funding for foster care and adoption assistance. And it's a calculation of FMAP, which I'm sure you've heard of lots of times, and then what's called the penetration rate. So in order to be eligible for that 4E funding for foster care, for example, certain court orders have to be met, certain activities have to be completed, and our penetration rate for foster care is right around that 45-50%. We're kind of in the middle of the country in terms of the level of our penetration rate. It's much higher for our adoption cases. It fluctuates between 80 and 90%, which is great. So we're getting more federal assistance on the adoption end. So the federal requirement allows states to pay for adoption subsidies or requires them to be terminated at 18 years of age or such a greater age as the state may elect under the law, and then 20 years of age if the state determines the child has a mental or physical handicap which warrants the continuation of assistance. So the main point there is that the federal statute allows for some flexibility to go beyond that 18 years of age, but our current state law does not. And so you can find the adoption subsidy information, including who qualifies, when it terminates, in Chapter 127 of the Nevada Revised Statutes. And it requires that all financial assistance provided under section ceases immediately when the child attains a majority, becomes self-supporting, is emancipated, or becomes deceased, whichever comes first. So a revision to that statute would allow us to take advantage of some of that federal flexibility that we do not have. Of course, that would require an investment in general fund match to get those federal funds. If Nevada opts into the federal 4E extended foster care program, the adoption subsidy could similarly be extended for some foster youth. So we're going to talk about AB 150 next, which talks about that. But so that's really it. Before I go on to the AB 150 specifics, that's the overlay. The bottom line is there's federal flexibility that we don't currently take advantage of in Nevada based on our statutes. A change in our Nevada statutes could allow for assistance beyond that 18th birthday. And of course, we'd have to do a fiscal analysis on that, which we'll try to do and get to you shortly after this meeting in terms of what would that really look like. If we said, okay, on average, it's 6 months more of assistance if we get to high school graduation, what does that cost really look like in terms of general fund? Or if we were to go all the way to 21. So we can put that together and we'll submit that to the committee. So I'll pause there and ask if there's any questions about the adoption assistance program. A lot of it is prescriptive through federal and state statute.
Do we have any questions? Dr. Hardy?
Thank you, Madam Chair. What is the difference between the family who says, I'm just going to be foster parents? What is the state, county, federal payment per month for foster payments versus adoption? Is there a benefit for the family to adopt fiscally, or vice versa?
No, so I think one of the reasons that the adoption subsidy amount can't go over that regular foster care amount is that so that we're not creating a fiscal incentive just to adopt. So there's not really a fiscal incentive to go from adoption or to go from foster care to adoption. We have some families that want to just provide foster care and become a resource parent and really work with the biological family on reunification. And there's a real shift in child welfare practice in terms of really facilitating that relationship with the biological family and the foster family. And then there are some families that just become foster parents with the intent to adopt down the road. And so they may have some foster kids, come in and out as there's a need, but they're hoping to adopt. So there's not really a fiscal incentive created to adopt versus becoming a foster parent.
Is there a fiscal disincentive to adopt?
I will take a look and see, and there's none that come to the top of my head. I think and believe that most of the families that shift from fostering to adoption want to do it to build that family, to provide that permanency for those kids who have been abused or neglected and need their forever home. There's a lot of support that goes around.
Let me ask it this way. How much a month do you get as a foster parent versus how much a month do you get as an adoptive parent?
So the amount was on slide 7. So the family foster care maintenance rate is at $682 a month. And then for the older youth, it's the $773. Again, the adoption amount can't go above that, and our averages for the 3 jurisdictions in terms of the negotiated amount floated right around $630. So it would be $50 to $150 less per month as you shift to adoption.
And that would be negotiated in some way.
Yeah, that's negotiated between the adoptive family and the local child welfare agency. So for Clark County, that would be Clark County Department of Family Services. In Washoe County, it's a Human Services Agency. In rural Nevada, it would be the Division of Child and Family Services.
Appreciate it. Thanks. Thank you, Madam Chair.
Thank you. And then I have a question about on slide 9, the additional resources for families from ADSD, the Family Support Services. And I guess also the available subsidies with the social services. We've talked before about not having enough services in Nevada. So are the families that are trying to take advantage of family support services, are they getting enough services? Are they waiting? Are there a lot of wait times? Is it available for them? Is there enough available for them that it's worthwhile?
So the items that are on top of slide 9 are all the eligible activities for the subsidies from the federal perspective for the adoption piece. Those other resources, especially as we talk about youth with developmental disabilities, oftentimes they're plugged into the Aging and Disability Services Division. Already there are some additional opportunities once they hit that age of 18 and become independent. And so that would be, in terms of the wait lists and everything, we can get you the HHS caseload data in terms of waiting lists for different services. But I think across the board, we do not have enough services for our families to meet all of their needs. And really trying to look towards, different models of delivering services and really working on that kind of holistic approach to serving families.
Okay, thank you. And seeing no other questions.
I have a question, sorry.
Dr. Titus.
Sorry, Madam Chair. I have a question regarding the, as you said, there's not enough services across the state. And I know over the last couple sessions, we've required more training to be a foster parent. And one of the questions I asked during those hearings would we, by mandating some of the training and the extra time and hours, were we going to lose people who would be willing to be foster parents? And I was just wondering if our our numbers are going up or down? Was there any impact on that? And expectation for the future?
Ross Armstrong, for the record, there is no indication that those additional training requirements are reducing interested foster families. What we see is some drop-offs during the foster care licensing process, going through all of the different, foster care licensing, and then some drop-off of folks who become foster families and it may not be quite what their expectations are. And so having that better training that explains what foster care looks like. There are some folks that struggle with the idea of, I'm going to take in the child who's been abused and neglected, and now, I'm being directed to really work with the person that abused and neglected that child. We know that in the long term, that's better for the child if we can reunify. And so making those expectations clear up front. We are in a desperate situation in Nevada in terms of not nearly enough foster care beds. A bill last session required each child welfare agency to come up with a plan and a recruitment plan to make sure that those foster care beds were in place. And so the agencies have just started to implement that annual reporting of where we are. And we can certainly send the last annual report to this committee so you can see what that looks like in terms of agencies trying to recruit enough beds and really finding, we do the direct services in rural Nevada. And so what you need is enough foster beds to meet all the potential needs that come up. We have great foster parents down in Pahrump who are, we have a good pool of foster parents there that work with older kids, which is great if a youth comes from Pahrump. But when we've got a youth who needs a bed, and if from Elko and the only bed is in Pahrump, all of the goals of the child welfare case are frustrated, by that hundreds of miles of distance. So really trying to target making sure we have enough beds in every Nevada community for any situation that comes up. It's a heavy lift, but all three agencies are working towards that.
Right. Thank you for that, because I'd really be interested in seeing the outcome of what you've just asked your agencies to do. Because one of the things we also talked about was making sure we keep the kids in their schools, the school-age kids, that we didn't want to take them out of their local schools, their local friends, and make matters worse. So that was one of the goals, is to make sure that we could provide the beds within a community, not only within a community, but within the school districts and within, although now, we're kind of gone virtual with this COVID nightmare, but at the same time, eventually we'll get all these students back in school. So I would just really be interested in seeing what efforts your agency has put forward and if they've been successful and how you're trying to mitigate some of the need for these beds. So thank you for that.
Seeing no other questions, why don't we move on to Assembly Bill 150.
Okay. So Assembly Bill 150 passed last legislative session, and it required the state of Nevada to study opting into extended foster care. Another bill from last session that this committee might be interested in is Assembly Bill 111, which required a study of how the child welfare agencies, if there were opportunities to maximize federal funding. That study is all being done in the Interim Child Welfare Juvenile Justice Committee, and the draft reports there's no secret treasure chest of federal funds out there that we haven't tapped into, but it does help provide a roadmap for options in the future if there are places where we want to invest the general fund match. So Assembly Bill 150 addresses extended foster care, and that's the federal term. It can be a little bit misleading, I think. Extended foster care is really about providing all of the supports you would with a foster youth to a young person over the age of 18. And so it's not that they're necessarily living in a foster home and having court all the time and trying to find an adoption, but really bringing financial and other resources, care coordination, those types of resources to youth over the age of 18. The bottom line of AB 150 was to figure out how Nevada can improve outcomes for youth aging out of the foster care system. We know that the outcomes for youth who age out of the foster care system are poor. You see high rates of incarceration, high rates of future allegations of abuse and neglect, that multi-generational involvement in the child welfare system, homelessness, incredibly poor health outcomes. And so we try to find permanency other than aging out of the foster care system. And so the bill takes a look at that. There was appropriation with the bill that allowed us to contract. We contracted with social change partners, which were experts really in the field, who have helped guide the committee over this interim. The group was required to look at the programs and practices of other states, the funding programs and practices currently in place in Nevada. So the voluntary court jurisdiction is a program that Nevada already has. It is 100% general fund funded, whether that's through legislative general fund or county general fund in Washoe and Clark, and provides resources for youth 18 up to the age of 20 in terms of a monthly fiscal payment to help them with that transition. And FAFI and CHAFI are federal funding sources that assist youth. So we were supposed to study the potential of ways to improve outcomes, including the federal 4E extended foster care program, which would bring in that federal funding to maximize assistance to those transition aged youth, to estimate the fiscal impact, and the report is due October 1st. So we assembled the working group, which included everybody you see there on the screen. I'll note that the Nevada System of Higher Education has implemented a tuition waiver for youth who have aged out of the foster care system, and really providing support in terms of higher education and opening up a pathway for those youth. It included foster youth and former foster youth and parent advocates. So we really had a lot of folks at the table, all trying to figure out how best to help those transition aged youth. The contracted group helped us look at a number of other states you see there on the screen. The federal parameters around extended foster care are much more flexible than for traditional foster care. And so states have a lot of ability to mold the program to their needs, which includes how do you make placement determinations? How do you figure out where the payment goes? Is it just directly to the youth? Are you allowed to give some money to the youth and some money to, let's say, the housing where they're living? Who's eligible? So there's a lot of different factors, and they looked at a bunch of different states in terms of were there good ideas out there that we could steal for us. We also took a look at the current practice, again, the voluntary court jurisdiction, and then the FAFI funds, and what that looks like in terms of extended foster care, what would need to change. And really, between the court jurisdiction and extended foster care, some of the key things that would have to change is there would have to be some additional determinations made in terms of making each youth eligible for that federal 4E money, and then regular reviews by a court or other entity, making sure that support is still appropriate. And then some additional requirements around the placement types that were permitted, and additional casework and visitation requirements that look more like foster care in terms of mandating that caseworkers have thorough visits and are working with the youth on a regular basis. So really took a look at what does it take. The truth is we're really not that far off in terms of the eligibility for entry. The state statute has some of the language of the federal statute. And so there would not be too much of a heavy lift in terms of programmatic change. The biggest ones being some of those placement oversight requirements, the caseworker visits, knowing what the caseworker caseloads look like already, and then some additional stuff over review and eligibility. We asked all the stakeholders really 4 main questions. We've compiled those. The vast majority said, yes, we think we should proceed with going forward with extended foster care programs. Some have concerns about the cost benefit. And so we're currently doing an analysis right now statewide to see what that would look like in terms of the cost of those reviews and administering the program versus the federal funding that would come in. It would be a separate penetration rate. I talked about the penetration rate earlier in terms of foster care and adoption. This is a whole new population that would be an extended foster care penetration rate that would dictate the extent to which we could pull down the federal funds. So the recommendations have all been submitted by those groups. We're working on synthesizing those to, in a helpful way to the Interim Committee on Child Welfare and Juvenile Justice. And then we've assembled a fiscal subcommittee to really dive down into the costs, especially given our state's current fiscal emergency, and to take a look, in terms of comparing potential progress on AB 150 versus extending adoption subsidies, because we already invest general fund in this a similar type of program. The investment, I think, would need to be less because we're already doing it. It would just be potentially able to bring in that federal funding. How it weaves in with adoption assistance is many states align their adoption assistance programs for youth ages 18 to 21 with the conditions of the 4A reimbursement. And so if we were to extend foster care out to age 21, it would make sense that at the same time we could potentially increase adoption assistance that far as well. Given our current fiscal state, I think it would definitely be worth taking a look at what would it really cost if we were just to extend it towards that end of high school. It would be a much less fiscal impact than all the way to age 21. And so if the state opts into the federal 4A extended foster care plan, the age limit for adoption assistance would move to the age set by the state's program. So for children adopted on or after their 16th birthday. So there's some interplay there in terms of the adoption assistance, and the fiscal analysis we're completing now as part of AB 150 would take a look at that as well. We haven't really talked about it a lot today, but guardianship assistance. There are cases where guardianship is preferred over adoption. A lot of times we see this with a family member. So either a grandma or aunt who has trouble with the idea of advocating for the termination of their family's rights to the child. Guardianship is an option, a permanency option. There's more and more resources for guardianship and helping families navigate that. And so it could also be extended to the age of 21 in terms of assisting those guardians fiscally. And extended foster care, we don't have to go to age 21. That's another flexibility. The federal rules are written in such a way as we could set that age to wherever we feel is most appropriate, or in the reality we face now, what we can afford. And so I'm happy to take questions on AB 150 or AB 111 or any other items, but that AB 150 I think helps as we really take a look as an agency, as the Division of Child and Family Services, in terms of how do we give families, all families, adoptive families, families that are involved in our mental health system or juvenile justice, how do we empower them to leave our involvement, right, for us to say goodbye and to have them only return like on a voluntary basis? How can we really support an effective path forward for every youth and family that we're involved with? And so both of the items we've talked about today are critical to supporting Nevada's families and really giving those young people who have started out in a difficult position a brighter path forward. So thank you. We're usually in front of the Interim Child Welfare and Juvenile Justice Committee, so it was great today to present to a little bit different committee, and I'm happy to take any questions that you might have at this time.
Thank you for the presentation and all of the information. Do we have any questions on the second part of the presentation? Okay. Seeing none, we'll certainly look forward to the information that's provided to the committee in October when the report is given then. Let me see. And to see what the fiscal subcommittee comes up with in October. I think that's going to be very interesting to see. And then just, I guess not so much a question, just a comment, just following up on the first part of the presentation. And just something else for the committee to consider. It occurs to me as I've said before during hearings that during my day job, I'm a family law attorney. And so just to note that we've already established in law in Nevada that when parents are divorced and they're paying child support, if one's paying child support to the other, child support continues until the child turns 18 or 19 if they're still in high school. So something to consider that we've already established in the IRS, that it is important to continue to support a child until they actually get through high school. So take that for what it's worth. But thank you, Mr. Armstrong, for the information, and thank you, Mrs. Robertson, again, for your family story. And I think with that, with no other questions, we will move on to agenda item number 7, which is an overview of food insecurity in Nevada and an update on Senate Bill 178 from the 2019 session, which establishes the Council on Food Security and the Food for People, Not Landfills program. And with that, we'll ask Laura Urban of the Food Security and Wellness Manager of the Office of Food Security of the Division of Public and Behavioral Health to provide her presentation. And I believe we have the executive directors of the major food banks in Nevada are also available for questions. So please go ahead.
Sounds good. Oh, apologies, I'm having some technical issues.
No problem.
Okay. Good afternoon, everyone. This is Laura Urban, for the record, Food Security and Wellness Manager. Let me share my screen. Okay.
The top one?
This one?
Yep. And then
That is his presentation. All right, there we go. Okay, can everyone see my presentation? Okay. All right, again, my name is Laura Urban. I'm the Food Security and Wellness Manager with the Office of Food Security within the Nevada Department of Health and Human Services. As stated previously, today I'll be providing an overview of food insecurity in Nevada, as well as an update on Senate Bill 178, which created the Council on Food Security and the Food for People, Not Landfills program. Food insecurity can be defined a couple different ways. So before I get started, I'm going to share the definition that I'll be using today, which comes from the United States Department of Agriculture. The United States Department of Agriculture defines food insecurity as the limited or uncertain availability of nutritionally adequate foods, or the uncertain availability to acquire these foods in socially acceptable ways. That is, resorting to emergency food supplies or other coping strategies. This slide compares national and statewide household food insecurity trends between the end of the Great Recession and 2018. It's important to note that the most current data that we have from both the United States Department of Agriculture and Feeding America is 2018 data. As you can see on this chart, household food insecurity has declined nationally between 2013 and 2018. Nationally, data show that the prevalence of household food insecurity declined for the first time to the pre-recession level of 11.1% in 2018. Nevada experienced a similar downward trend while there was a slight increase in household food insecurity between 2016 and 2018, though it still remained fairly consistent as the increase was not statistically significant. While progress has been made, the most recent Feeding America data show that 388,420 Nevadans are still struggling with hunger, of which 134,350 are children, or 1 in 8 Nevadans and 1 in 5 children. COVID-19 has exacerbated this issue. While it'll be a couple years until we have post-COVID data from both Feeding America and the United States Department of Agriculture, we do have a recent report that was just released from Feeding America, the impact of the coronavirus on local food insecurity, which shared food security projections for states including Nevada. In that report, they ranked Nevada as one of the states with the highest rates of projected food insecurity for 2020 compared to 2018. The same report ranked Nevada also for 3rd in the country with the highest projected percent change in food insecurity rates between 2018 and 2020, with a 7.2% point increase. Also, the report projected that in 2020, Nevada would be number 3 in the nation for the highest increase in childhood food insecurity, with a 13.4% point increase. Food insecurity is a very complex issue, and while there are a number of factors that contribute to an individual's food insecurity, there is a relationship between food insecurity and unemployment, as demonstrated on this slide. Unemployment rates among low-income populations make it more difficult for them to meet basic household needs, including food. And in addition, data show that children with unemployed parents have higher rates of food insecurity than those with employed parents. Since the end of the Great Recession, Nevada has made significant strides in addressing food insecurity in Nevada, in part through prioritizing it through the creation of the Council on Food Security. The Council on Food Security was first established by executive order in 2014 by Governor Sandoval, and at the time was comprised of 21 cross-sector members, including representation from state agencies, nonprofits, the for-profit sector, as well as both of our state food banks, the Food Bank of Northern Nevada and Three Square Food Bank. The mission at the time of its creation, and still to this day, is to effectively improve the quality of life and health of Nevadans by increasing food security throughout the state. The group is also tasked with addressing the objectives of their guiding plan, Food Security Nevada, Nevada's Plan for Action, which was originally developed in 2013 and then revised again in 2018. The Council on Food Security's greatest accomplishment has been the fact that it has provided a consistent platform for collaboration among the food security network to discuss and strategize the best ways to address food insecurity in Nevada. In addition, the Council on Food Security has also championed a number of food security policies, including breakfast after the bell, which was passed in 2015, which led to a 26.5% increase in school breakfast participation in just its first year of implementation. In the 80th Nevada Legislative Session, food security partners sought to codify the council via Senate Bill 178 and succeeded. Senate Bill 178 also established a new program within the Department of Health and Human Services called the Food for People, Not Landfills program. This new program is administered by the Office of Food Security with guidance from the council and was created to increase food security through decreasing food waste, redirecting excess consumable food to a higher and better purpose, and recognizing and assisting persons who further those purposes. Senate Bill 178 also made some slight changes to the existing executive order, including some changes to the membership with the addition of the Director of Health and Human Services and the Administrator of the Aging and Disability Services Division. It also changed the number of meetings. Previously, we met 6 times a year. Now we're meeting 4 times a year, knowing that we will have a number of subcommittee meetings each year. And then, of course, the creation and the implementation of the Food for People, Not Landfills program. We've made great progress in implementing the Council on Food Security under its new legislation. All existing members have been formally appointed under Governor Sisolak. We're just waiting on a couple new members to be appointed. The bylaws have been redrafted and approved by the council. We also have 2 existing subcommittees, one being the Food for People, Not Landfills subcommittee, which I'll talk about more in a second, and then the policy subcommittee, which was created to assess and recommend policy recommendations to the Council on Food Security for the 81st Nevada legislative session. Since COVID began, we have 2 meetings scheduled. One happened on Thursday, July 30th, where council members and partners shared their COVID response efforts. And then our next meeting is scheduled for Tuesday, October 6th, where the group will discuss their priorities and goals moving forward. For the Food for People, Not Landfills program, like I mentioned before, we established a subcommittee, which is helping to develop and guide that program. That subcommittee is chaired by Jody Tyson of 3 Square Food Bank and is comprised of 5 voting and 5 ex officio members with representation from Nevada Department of Agriculture, MGM Resorts International, and Catholic Charities of Southern and Northern Nevada, just to name a few. The Food for People, Not Landfill program did submit its first annual report in January of 2020, and they're currently working to develop the scope of work and a baseline report. The subcommittee is also working to develop the program seal, which is required per the legislation. And once developed, that seal will be shared with participating organizations. Thank you for the opportunity to present to you all today. That concludes my presentation, and I'd be happy to take any questions or comments at this time.
Thank you. Do we have any questions? Okay. Seeing no other questions, I have a question going back up to the definition of food insecurity. When we talk about nutritionally adequate foods, so if someone's got enough food that they're eating, but it's junk food, does that still meet the definition of being food insecure? So someone who lives in a neighborhood where they're mostly just getting their food from a convenience store and it's highly processed, lots of sugar, sodium, fats, that type of thing, not a lot of fresh fruits and vegetables, would that be considered food insecure?
Or for the record, absolutely, per the USDA's definition, that does qualify as being food insecure.
Thank you for that. And then, so as over the last year or so, as the new work has begun, with, I mean, obviously you've been working in this field for a while, but since Senate Bill 178 was put in place and the council's been working on this, has there been anything that you've seen anecdotally that's kind of surprised you, or that you've learned that you didn't know before you started the work set out by SB 178?
Laura Urban, for the record, I would have to think about that more. Not necessarily. Prior to being in this position, I worked at the Food Bank of Northern Nevada and worked directly with the community. So I saw a lot in that, being in that position, probably more than, I mean, now this is a completely different perspective. So that's been very new and interesting. But no, nothing that has really surprised me.
Okay, and then as we have, we have a lot of, I think, people who watch these hearings and maybe aren't sure how they can best assist as, because they want to help their fellow Nevadans. What's the best way for regular Nevadans to help to make sure that they're getting, if they want to assist, to make sure that they're helping feed their fellow Nevadans? Is there better ways to do that than other ways?
Laura Urban, for the record. I welcome both food banks to speak to this, but from my understanding, getting connected with your local food banks and food pantries and volunteering is the way to go, as well as monetary donations, especially during this time.
Thank you. And certainly, I believe we've got directors from the food banks. If you'd like to take a couple of minutes and just make a statement and just introduce yourselves, tell us about your food banks, where they are, if there's anything in particular you'd like us to know, please feel free.
Yes, good morning. This is Ashanti Lewis, for the record, from 3 Square Food Bank. Thank you for allowing me to answer your question today, Chair Cohen. As Laura said, you can donate to the food bank, and we also need volunteers at our mobile distribution. And all of that information can be found on our website, which is 3square.org. It's spelled out THREESQUARE.org. So that's the best way to find information about what we are doing in the community. Currently, we have about 30 mobile distributions per week through a partnership with the Clark County School District, amongst other pantries and other locations. I'm sure many people have seen our distributions on the news. We have several hundred cars at many of them. And so we are looking for people who can come out and volunteer and help.
Thank you. And if I may, Ms. Lewis, so a couple days ago, someone contacted me and said that someone they know gave them a bunch of cans of soup and they needed to know, they wanted to donate it. And I didn't even think of 3 Square, because I think of 3 Square as having large donations, that you work in partnership with large organizations, that you do big amounts. If someone has small amounts that they want to donate, do you take small amounts, or?
Yes, Ashanti Lewis for
a couple bags of groceries. Oh no, would you accept a couple bags of groceries?
Ashanti Lewis for the record, absolutely. Absolutely. They can come to our main location. Again, that information can be found on the website, and we can take those donations. We do food drives throughout the year, especially during non-pandemic times. And so we welcome that from the community.
Thank you for that. Okay, and the next representative, please go ahead.
This is Shane Piccinini with the Food Bank of Northern Nevada. Our food bank serves the northern counties, basically from Tonopah north. And so we've got a deeper, sort of more rural reach than 3 Square does, although 3 Square has got a huge caseload doing the Las Vegas metropolitan area. So there are a couple of different ways where somebody could be involved in the food bank. As Ashanti pointed out, you could certainly volunteer to help pack foods, or to, in our warehouse, or at our help do a mobile distribution. But also we've got a monthly food drive that happens that you can find information for those on our website at fbnn.org. And this is the really important thing that I wanted to communicate, and I did communicate through a regular update for the legislature during the worst part of the economic shutdown, was that there are a lot of places for people who can get help. So we offer the Kids Cafe after school meal programs. Now that school has started, we just finished with summer food. We have got mobile distributions in just about every county that we serve. And the schedules for all of that is on our website under Get Help. And so outside of the federal nutrition programs, the TFAP, SNAP, there are no income requirements to get access to our food. So if somebody is in need, if they were recently laid off or if their hours were cut, they can absolutely come to one of our distributions or to one of our 145 partner agencies and get the assistance that they need.
Okay, thank you. So you're saying that if someone not necessarily going to be without a job for a long period of time, but just maybe for a week is going to need assistance, something to get them by, they can just come in.
Absolutely. They can come to, right, absolutely. Shane Piccinini for the record. That is true, Chair Cohen. So if they need like emergency food today, it doesn't matter why, they can go to any one of the partner agencies that might be closest to them, or they can look up our mobile harvest schedule and go there. And absolutely no questions would be asked. We will absolutely assist them.
Thank you for that. And I believe we have a question from Dr. Titus. So before we go on, Dr. Titus, please go ahead.
Oh, thank you. And thank you for being there. And I have to tell you that my awareness of food insecurity really was augmented when Shane asked me to come and speak to the food bank this last year, and having to educate myself on so many folks that really didn't know where their next meal was coming from, and appreciate all the efforts that you do throughout the state, and especially obviously in Northern Nevada for the folks in the rural areas too. And I think my question may actually, I'll probably ask Director Ott this also, but my concern was with the schools being closed, so many of our youth really, the one guaranteed meal they have is through the school program, through the SNAP programs, whether it's the breakfast, whether it's their lunch. And I was just wondering if you had any data on increase of the children that were served since school was out, and how were we able to coordinate with the different school departments in each county and to make sure that those meals were being served. I heard Three Squares did work with the Clark County School District, and I was wondering what school districts that you worked with, because I had huge concerns over this closure of these schools and what we were doing for the kids during that time and throughout the summer, and if you had any numbers on the number of youth that you actually served.
Shane Piccinini for the record for you, Chair Cohen. The Food Bank of Northern Nevada collaborated with the Washoe County School District to make sure that the kids during the shutdown in the Washoe County schools got meals. And so we had about 20 distributions set up that allowed the kids to get multiple day. So they only had to come a couple of times to get multiple day meals in order to help encourage the social distancing piece. And so we were serving about 40,000 kids in Washoe County. And then as far as the rural counties go, the sponsorship of some of these programs was broken up. So I know that the Boys and Girls Clubs in Winnemucca, Elko, and I believe in Yerington were also doing some of their own meal programs, but we can definitely get you a more solid list of child nutrition numbers. I know that Diane Hogan with the Nevada Department of Agriculture had sent me a list about 3 weeks ago, just before the end of summer, with some counts, but I can get it updated and send it out for you. And so I just want to say though that, you know, in Washoe County, we served about 300,000 meals through the entire shutdown. And the other thing that I want to emphasize in this entire process, though, is that we have got really strong relationships with the Nevada Department of Agriculture, with Three Square, with Catholic Charities. We really work hard to make sure that we have got a strong community reach. So I hope that's helpful.
Right. Yeah, thank you for that, because that was a big concern that we had was, again, just kids, where were they going to get their meals? And so thank you for following through on that. And I'd be really interested to see the numbers afterwards when some of this data can be collected. So thank you.
Be happy to.
And then from Southern Nevada, from 3 Square. Ms. Lewis, do you
Yes.
want to, please go ahead.
Yes, absolutely. Ashanti Lewis, 3 Square Food Bank. Chair Cohen, so CCSD continued to serve their meals at some of their sites, and I can get that data for the committee as well. One thing I would like to point out is we did have to suspend our summer food service program in order to follow social distancing guidelines. And so most of our childhood nutrition programs are at a standstill currently. We primarily work with volunteers. They come to our facility, they help to package kids' meals, and we just cannot have people in the facility at this time. We have upwards of 200 people come in per day, per time slot. So we are working to slowly bring in childhood nutrition, or bring back childhood nutrition.
Okay, thank you. And do you know what the school district is doing? Are you, if you're aware, if you know?
Ashanti Lewis, for the record, I am not completely aware. I do not want to speak to that just yet. I will get that information for you.
Okay, thank you. All right, and then I'm sorry if we have, I think we have another representative from one of the other food banks.
Hi, this is Alika Nematian for the record. Yes, but my colleagues have done a wonderful job explaining everything, so I haven't had the need to speak up yet.
Okay, well, and from which food bank?
And with 3 Square Food Bank, I apologize.
All right, okay, thank you very much. All right, and then was there anyone else we missed? Okay, seeing no one else, then committee, do we have any other questions? Okay, then thank you, Ms. Urban, and the other and the representatives from the food banks, and of course, thank you to you and all your staffs and your volunteers for feeding Nevadans for always, but especially the last few months. You know, it's done incredible work. Certainly, especially since the pandemic begun, we know that there were people who, you know, could within a week of not having a paycheck, people who had never had to utilize food banks were looking for places where they could go to get fed. So we really do appreciate that. With that, we're going to move on to Director Ott from the State Department of Agriculture to talk about food insecurity during the COVID pandemic. So Director Ott.
Yes, thank you so much, Chairwoman Cohen. I appreciate your time today. I am going to, can you hear me okay?
Go ahead.
All right, just sharing my slides here. Thank you all for your time today. I'm just going to spend a few minutes to talk about the food security efforts in Nevada through the Department of Agriculture and our many partners, and what we're looking at for next steps for food security in Nevada. And I just wanted to, I would be remiss, I always try to in a public forum, again, also to express thanks like you did to our food banks and all of our partners, our school districts, for all of their work. You know, we work with the federal agencies, we administer the programs, but they're the ones that are on the ground. And we just, you know, couldn't do it without them. So we really appreciate our working relationship. To start off, I just wanted to provide a quick cheat sheet for you. These are the major programs that we worked with COVID. These are not all of our programs by any means, but really these were the major ones that we were working with to address food security during those first initial months of the pandemic. The Department of Agriculture operates and administrates the National School Lunch and the National School Breakfast programs. You know, obviously when schools shut down in March, we switched really quickly to the summer food service programs. And there's 2 food programs. There's a summer program run by school districts, and then there's summer programs run by community agencies. And so those were both operational. I'll go into that in a little bit. The Emergency Food Assistance Program, the TFAP program, that's what Shane Piccinini was talking about with emergency food. That's what you would traditionally think about as food bank food. The Food Distribution Program on Indian reservations, our FDIPR program, that is a monthly supplemental food for our tribal communities. So food deliveries are provided to certain locations throughout the state every month. And then also our Commodity Supplemental Food Program, CSFP, which is monthly food packages to seniors. So as I'm going through this presentation, there's a bit of a cheat sheet for you. I'm going to just go through a quick timeline of our food response efforts for the first few weeks of when COVID really hit. March 4th, our team got together and really started looking at what was happening with the pandemic around the United States and around the world, and realized that we really needed to get some plans in place very quickly, pending what potentially might happen in Nevada. We weren't sure if we were looking at school closures, if we were looking at illnesses at kitchens, if we were, we just didn't really know what we were going to hit, but we needed to be prepared. And so our team put together basically two-tier plans to be ready for whatever direction we might receive. So on March 6th, we started discussing with USDA to get waivers in place to be able to address many of those issues that we were potentially going to come up against. The waivers that we received included non-congregate food sites, so that we were not collecting groups of people together, being able to serve food at sites other than schools, and also waiving area eligibility requirements. So we had those waivers in place on March 6th. And if Nevada wasn't first, we were definitely one of the first in the nation to have those in place, which was a good thing, because on Sunday, March 15th is the day that we heard the governor made the announcement of school closures and Directive 001. In the first 24 hours, we did a lot of phone calls. So, we were working with our school districts and our partners the entire time, but that was sort of really when we were able to put the plans that we had devised into place and started making those phone calls. One of the plans was to switch from the National School Lunch Program to the summer service programs, because that was a model that already had assets in place that we were able to do a grab and go meal service very quickly. And so there's some school districts that did not have those summer programs in place. So for that first 24 hours, we were signing schools up very quickly, sort of getting them enrolled in the program and dealing with the paperwork later. And so in the first 24 hours, there were 72 sites available for school children to receive meals. During that first week, as sort of the plans were in place and we discovered new roadblocks, we applied for more waivers and got them, specifically nutrition, as we were realizing that it was not able to source the food that we were needing to maintain those very strict nutrition standards for the school lunch program. So we got those waivers in place. Paperwork processing to make sure that we were getting all of those summer programs active. For our FDIPR program, that first week we had a truck going to Elko, and we were surprised, we shouldn't have been, but we were very surprised that we had almost double the number of folks line up in line there. So we had to very quickly pivot and send a second truck and get that done. And then the family's first act was signed on March 18th. So preparing for the funding acceptance there, IFC, that kind of thing. And I'm going to go into a little bit of the funding at a later slide and let you know how that really impacted us. And then by the end of week 1, there were approximately 150 sites up around the state. And that was specifically, to feed school children. That is the school children response. In week 2, we were working with our partners on food availability. We were starting to see trucks slow down when deliveries were supposed to be, at the food banks. They weren't getting there, and so working to make sure that they were going to get there and that they were just delayed. There was issues with staffing, of course. With the directive, more and more people stayed home. And so trying to work with the Department of Emergency Management to try to find some solutions for that. Again, transportation logistics. And then that second week is when illness reports started to roll in, either at feeding sites, and sort of how, those situations were going to be solved. And then the CARES Act was signed on March 27th, and preparing for funding acceptance then. So while all of this was going on, we were still working, the food banks were doing their great jobs with their missions. And obviously I'll see the numbers, you'll see the numbers in a bit, but there's an increase in numbers. But while all of this is happening, we're still working on essential services and agriculture, making sure our farmers and ranchers were getting the information that they need. Processing was starting to come to sort of a slowdown. We were starting to get reports of food shortages and what that meant for the state, and making sure that we were tracking distribution lines, and just, keeping an eye to make sure that we weren't going to be one of those states that, just completely ran out of chicken for a month. And so, and just keeping on top of that to make sure that if there was anything that we could do, that we were going to do it. There were some reports of dumping in the state. We were fairly lucky that in March, much of our produce season is not ripe yet. And so we didn't have produce dumping like other states did, but we did have aspects of milk dumping. There were dairies that, because of casino closures and because of school closures, couldn't fulfill their contracts anymore. And so we were able to work with those and other partners to redirect that milk to the food banks and other food response efforts. And also at the same time, looking for alternative programs. Boxing was an issue, trying to figure out how are we going to deliver boxes to seniors, working with our partners on that. And so we were able to take advantage of 2 alternative programs. The Meals to You program was a partnership with Baylor University to deliver a week's worth of meals to rural areas. And Esmeralda County was the recipient of the Meals to You boxes. And then also the Farm to Families box was a program that USDA stood up really quickly, redirecting fresh farm produce to food banks. There were a lot of hiccups with that. That program, like I said, was stood up really quickly. And so there was a lot of hiccups. And so working with USDA to get as many of those benefits into the state of Nevada as we possibly could. So this goes over a little bit of the funding. The Families First Act, did provide funding for food programs, provided $3.76 million through TFAP, but unfortunately what happened was that the Families First Act didn't waive the federal procurement processes. And so although the administrative funds were available for pretty quickly to provide assistance for staffing or for gasoline for distribution trucks, we weren't able to provide any food until July 1st because we were still under the federal procurement process guidelines. And so that didn't go as well as we had hoped, but then the CARES Act was signed quickly after. And the funding you see here is what was provided through existing federal programs. And then there were the state allocation of funds, of which the Department of Agriculture received $8.3 million for food purchases, and gaps that we were starting to see show up with the federal programs. The federal programs are very strict. They stay in their lanes. There's waivers for some items, but still it wasn't covering all of the cost of this new model of food distribution that we were experiencing. So we were able to take advantage of that. So Laura Urban in the previous presentation went over some of the unemployment data pre-COVID. Here is some post-COVID data, seeing again a spike in April. You'll see in the next slide that the unemployment data follows very closely with the emergency food data, so that we can see sort of the trend that it follows very closely to unemployment. I looked yesterday and they did not have their July data out yet. So this is what we have here. This next slide is the TFAP, the emergency food participation. Like I mentioned, you can see that it spiked in April, which tracks with the unemployment data. What is really interesting to see, and also if you think about it, really exhausting for all of those folks that are working on the ground, is from February to April, we more than doubled the number of individuals that are participating in emergency food distribution. So it's quite a problem. And the other numbers that we're tracking is our FDIPR program, our tribal community program. If you see this doesn't quite follow the unemployment trend, what this does follow is more of the trend in the availability of food in grocery stores. And so since many of our tribal communities are in rural locations, and in rural locations, you usually only have one, maybe two if you're lucky, opportunities for grocery stores. And so when there was the hoarding problem and food shortage problem, that really was a much bigger impact in our rural communities. And so this trend line reflects that more. It's also the same feedback that we have received from other FDIPR administering groups that's the trend they're seeing. We are dipping down to pre-COVID numbers, and we think that's also just because of SNAP adoption. There's more people participating in the SNAP program because you can't participate in both programs at the same time. So, and I just wanted to reference Dr. Titus's question on the last presentation. Food banks, you're off the hook. Department of Agriculture can gather those numbers together about schools. When the question was asked, I was furiously looking through my papers on my desk because I know we have those numbers. I just couldn't find them fast enough. So we'll provide those to you. So on the next steps, we're looking at food security with the Department of Agriculture. We're really looking at three main things, and these are very themes, and these are very high-level themes for us, and where we're trying to guide some of our policies and some of our relationships moving forward. Our first main theme is continuing to represent Nevada on a national level to receive the funding we need to address food insecurity. And so working with our federal delegation and working directly with the USDA office in DC to really receive the funding that we need. And to be able to do that in funding innovative projects, new partnerships, organizations that may have been, I've called them pop-up food locations, but a lot of really great organizations that because of the pandemic, they've really answered the call to service. And it's, those folks that we really want to support. And so, really fighting for funding to do that. Using new communication tools. I think that, in the era of this pandemic, we've really learned to adapt to a whole different way of doing things. And we can really really take advantage of that and make it work for us to address food insecurity. And then also improving our internal procedures to address any efficiencies that are lacking so that we have a more effective relationship in addressing these issues. Our second main theme that we are pursuing is looking at a total food system approach. When we talk about addressing food security, we're often talking about the distribution portion of it. You know, we order the food, or our partners order the food, gets it into the warehouse, you know, packs it, and, you know, gets it out to the groups and the public that needs it. But we'd like to kind of back up the steps a little bit and look at the entire chain. How can we improve that response by looking at food processing and packaging, by looking at food production, and how can we support this whole entire chain to have a better end product and to be able to deliver to those food insecure populations quicker and with more healthy food. And so we're really looking at a total systems approach. And the third main theme is, you know, breaking out of our federally designated separation. So we have these federal programs, which are great. I mean, they have been very successful in the state. You saw some of the pre-COVID numbers that reducing some of the food insecurity pre-COVID, but you know, we have TFAP for emergency needs. We have school lunches that provide school children with meals during the day. We have CSFP for seniors. We have our tribal community programming, but we'd really start to look at who's feeding the family, whatever unit that family looks like. And how do we make sure that that family has food for dinner every single night on their table? And so really looking at how the state can be more involved in filling those gaps so that we're really looking at the family needs for food and food insecurity. I won't go too much into Food Security Council because Laura Urban already covered that. But I just, I wanted to mention that I was absolutely honored to be selected as chair of this committee about a month ago. And so I'm really excited about working in just an expanded capacity with my colleagues going forward. And with that, here is the contact information for our Food and Nutrition Division Administrator, Homan Anushapur, her and her team have just really been amazing for the last few months and continue to rise to the challenge. So I'm very grateful for them and I'm happy to take any questions.
I have a question, Madam Chair.
Go ahead.
Thank you. I moved outside, so you might have a little background noise here. My waterfall is going and had to just get outside. It was too hot in my house. So thank you for all that you've done, Director Ott. I have had huge concerns with, again, the access, as I brought up, especially for our youth. One of my questions is, what kind of waivers did you have to get for the food industry? I know in one of the districts that I represent is Fallon. And as you know, in my community here in Smith Valley and in Churchill County, there are tons of dairies. And I know that one of the dairies actually opened up and said, hey, come and get your milk because they couldn't distribute that. And so I just think that community stepped up with some of this. And so what waivers, what hurdles did you have to go through specifically to allow that kind of thing to happen? That was my number one question. Number two, I know that in the Midwest, especially, there was a lot of dumping of meat products because the meat packing plants had to close down. There wasn't, so, we would go to the store and the shelves weren't just empty of toilet paper, but they were empty of food, especially some of the meat products. As you mentioned, chicken and some of those meat processing plants that were closed. What did you do and how could you help with that?
So thank you very much. This is Jennifer Ott for the record. I think that the answer to this question is really, it's the same answer to both questions. So let me know if I miss a nuance, but As far as waivers go, there wasn't really any waivers for the agriculture community to be able to move forward. I know the gentleman you're talking about, and they just really did that as a community response, and it was just really a wonderful effort by them and their family, and and similar dairymen and ranchers across the state have done similar things. There's not waivers in place specifically for that. However, we are looking at, through the CARES funds that we were granted, assistance to producers to be able to develop new market opportunities, to develop new ways to market. We've released RFPs to work with partners to be able to address those needs, and those I believe the last one went out this past week, and then a previous one, to be able to develop more tools to get products to market. And so it wasn't really any waivers, as more as it's just assistance and being able to be here to answer the questions, to direct producers into their assistance categories that would work and be and it would meet their needs. And we have actually, through CARES funds, have been able to hire somebody, and that is their full-time job, is to be able to help people fill out those applications, answer those questions, and really work with the producers to help them through that. As far as the processing facilities and the meat, the initial depopulation of animals through the processing facilities is not something that we saw a lot of here, because of our climate. We're set back a little bit, which allowed our processors, our producers, to plan a little bit more. And we're also sort of very early in the supply chain of food. Our animals go to market later. And so we are seeing impacts of having to hold back cattle or other animals longer. And so there are increased feeding costs there. But we haven't had the same issues as we've had with other states when processing came to a grinding halt because of restaurant closures. Does that help?
Yeah, it does. Thank you very much. I just want to acknowledge all the work you've put into that, to this whole process, and how important what you do is to the state of Nevada. So thank you.
Thank you, Dr. Tice.
So, Director Ott, kind of following up on Dr. Titus's question, and getting back to the issue of dumping, that I definitely appreciate your testimony early on that we had very little dumping, and I certainly appreciate that there were local producers that opened their doors instead of dumping and said, please come take, so that they weren't dumping. But is there anything that the legislature can do, anything that we can do in statute that can help, whether it's COVID, whether it's some other emergency in the future that we can put in place now, so that if there are issues in the future, that to help so that dumping won't be an issue. So I know I'm asking you to look at the crystal ball and say, well, what could happen in the future, but is there something that can be done to help prevent that in some way?
I think so. I think the easy answer is, this is Jennifer Ott for the record. The easy answer is yes. It's the more complicated answer is it depends. So it depends on the industry. It depends on the timing. So there are some industries that are either through cooperatives or through federal intervention do receive some funding for, when there's circumstances that there is a dumping of a food product. There's, so it really depends. Yes, and we're working on a proposal for you all, and I'd love to be able to talk about it now. I just, we don't have it fully formed, but we are working on a proposal that would potentially address that, not in a pandemic. It would be looking as, just like we had, like one of my slides earlier, as a total food systems approach, is working with producers, working with processors and packaging to be able to address food insecurity. And so, yes, we will have a proposal for you.
Great, thank you. Do we have any other questions? Okay, seeing none, we certainly look forward to seeing that proposal. And thank you for the information and all the hard work as well, and for getting us ahead of the curve early on when the writing was on the wall about the pandemic. And definitely that goes to you and also your team. So we appreciate that.
Thank you so much.
Thank you. And with that, we're going to move on to agenda item 9, which is public comment. However, we need 3 minutes to have the live stream catch up. So I think what we're going to do, the live stream needs to catch up, and we need to give members of the public a chance to call in. So why don't we take a very, very quick break to allow members, or to allow the public to call in, for the live stream to catch up, for us to stretch our legs. And so let's aim to be back in 3 minutes. We'll be back in 3 minutes. Okay, and we are back from recess. So we are going to go ahead with agenda item 9, public comment. Again, public comment will be limited to 2 minutes. Let me get my stopwatch ready. And the speaker will be asked to state and spell your first name and last name. And you may also submit your comments in writing. BPS, please have the first caller begin.
Thank you, Madam Chair. Will the caller with the last 3 digits of 222 please slowly state and spell your name for the record? You will have 2 minutes, and you are now unmuted.
Good noon, Madam Chairwoman and the committee. My name is Sarah Adler. Can you hear me?
Yes, please go ahead.
Are you? Oh, good. All right, Sarah Adler, SARAHADLER. Today, I'm joining you as the board chair of the Healthy Communities Coalition of Lyon and Story County, and I wanted to add some information on food security from the local level. We operate 3 food pantries in Lyon County with an amazing crew of AmeriCorps staff and loyal volunteers. We cannot say enough thanks and good things about Food Bank of Northern Nevada. We're already serving hundreds of families a week, and the need has increased significantly since the pandemic began. One of the needs we are seeking to meet is to be able to do homebound delivery to folks who are vulnerable to infection. So our response has been to apply for a community development block grant. They have coronavirus funds. CDBG is operated for rural Nevada by GoEd, and they do a great job. But I feel it is significant to share that GoEd, since the last recession, has put an economic development lens on CDBG, more so than community development needs. And since our basic mission is poverty mitigation, we feel it needs to be understood that a key to providing a workforce to enable economic development is to mitigate poverty and help people into the workforce. Also, so many people due to age and disability in Nevada are not going to join the workforce, but CDBG can help meet their needs. We are hopeful that our application will be recommended to the governor on September 1st. I just want to close by saying that I'm proud to have been a founding member of the Governor's Council on Food Security. I thank Laura Urban for the great job she's doing, and I am so excited to have Jennifer Ott in a leadership position at Department of Agriculture and on the council. She comes from growing the small farm sector, and I think she's just demonstrated her desire and the ability of her team to implement the food security plan and integrate food systems in Nevada. Thank you very much.
Thank you, caller. Will the caller with the last 3 digits of 653 please slowly state and spell your name for the record? You have 2 minutes, and you now may begin. Go ahead, caller.
Okay, this is Dora U.L. Martinez, DORA-UCHEL -Martinez, MARTINEZ. Good morning, Chairwoman Cohen. Thank you so much for the opportunity. I would like to just agree with the last caller in regards to people with disability and underlying health issues. I'm just going to put this out there. The Nevada Center for Independent Living does a temporary food assistance program, and the phone number is 775-353-3599. It's specifically for people who have any type of disability, and they do the Instacart where they will call you. Once they identify you, they will call you and customize your shopping grocery list, and the store will drop it to you. So if you're like me, you can't legally drive, they will drop the groceries at your doorstep. And also in the Southern Nevada, there's 702-889-4216, Southern Nevada Center for Intermittent Living, and they do the same thing. And I would please encourage the staff for the food of Northern Nevada to include, maybe they can work, collaborate with other nonprofit organizations to establish, when people come in and fill out the application, once they're identified as disabled and they cannot come independently, that maybe they could have like somebody to volunteer once a week or a month or however they plan to do to drop groceries at their place. Because like me, I take the city bus, and sometimes when I go to the pop-up food pantry place, their food are either gone or the line is too long, and it's so hot that my black lab is too hot for him. So I got to be mindful of my service dog. And thank you so much for the opportunity. God bless you all. Thank you. Have a great week.
Thank you, Madam Chair. The public line is open and working, and there are no other callers at this time.
Okay, thank you very much. Before we move on to comments from the members, I believe Mr. Robbins has some answers for us for some of our questions from earlier in the hearing. So Mr. Robbins, if you please go ahead.
Yeah, so Eric Robbins, LCB Legal. There were questions earlier in the hearing about basically whether an ambulance is obligated to pick somebody up. And so I was unable to find anything in state law that imposed such an obligation. I will let the committee know later if I am able to find something like that, but I don't think there's anything in state law or regulation that says that. I think that the way that it works with ambulances is pursuant to chapters 244 and 268 of NRS, counties and cities are authorized to provide ambulance services either by providing them themselves or providing it through an exclusive franchise agreement. And then the franchise, if they enter into a franchise agreement, that franchise agreement will spell out the obligations of the ambulance provider. So those would be legal obligations imposed through contract. And then the city, if the city provides them the ambulance service itself, then it generally has something in the city code about what it's going to provide. Like I was looking at the Carson City Code, and they provide that Carson City is going to provide 24-hour ambulance service, and then it establishes the fees for transport. So I think that that's generally how it works, that the obligations are generally imposed by either the contract or the city ordinance as applicable. And then I wanted to know one other thing. EMTALA does apply to hospital owned ambulance services. I don't know if we have any of those in Nevada, but if we do, EMTALA applies. So if they pick someone up, they are considered, that person is considered to be to have come to the hospital for emergency services pursuant to EMTALA. So then the hospital is required to treat somebody that its ambulance service picks up. So that's what I found on that.
Can I ask a question on that?
Sure.
So you in your research, you looked up and you saw that the counties are authorized to provide emergency medical resources, and then they establish ordinances. But is there an obligation? Must they establish resources? Must they have either a contract or some sort of emergency services? Are they obligated to?
I think that it is an authorization. Let me look at the statute real quick, but I think that, let's see here. 268,081. 268,081. It says, the governing body of an incorporated city may displace competition in the area of the ambulance services, and then it may provide those services pursuant to, or it may provide those services on its own or grant an exclusive franchise. So it's not, there's
Not a must.
requirement.
Okay, thank you.
All right, thank you for that information. Before we adjourn, committee members, any comments? Okay, seeing none, this will conclude our meeting for today. Our final meeting and work session will be held on Monday, September 14th at 9 a.m. It will be virtual. Thank you, everyone. Thank you, staff, as always. Thank you, BPS. And with that, we are adjourned.